So my name is Norm Buckley. I am a chronic pain clinician and anesthesiologist based at McMaster University in Hamilton. Since 2016, I've been the nominated principal applicant for the Chronic Pain Network, which is a CIHR-funded national pain research network, which now has a shift to focus on knowledge mobilization as well as research and implementation science. And we're currently at the stage now of having 2 years of transitional funding to establish ourselves as an independently funded entity in the pain ecosphere. 10 years ago, the Chronic Pain Network was funded by CIHR as a national chronic pain research network with added direction to develop training for highly qualified professionals in pain research, but also engage in knowledge mobilization to ensure that the best information was in fact making its way into the public sphere and to policymakers. One of the big things about the Chronic Pain Network is that it has a specific mandate around patient engagement in research. So we have formal structures to ensure that all of our governance is co-managed by people with lived experience in pain. That patient engagement is a big piece of our mandate. And the interesting thing about that from a policy standpoint is that we became a target group when Health Canada reached out to our patient engagement committee, and that ongoing discussion led to a healthcare forum where the federal minister of health at the time, Jeanette Petitpas-Taylor, announced that she would be forming a Canadian pain task force to look at the issues of chronic pain in Canada. And that ultimately led to the Action Plan for Pain in Canada, which is a national health strategy that addresses many of the issues of pain, including the need for research funding, the need for research infrastructure, the need for greater public awareness, the need for better packaged information coming to policy, the need for better access and more consistent access to appropriate chronic pain care, which doesn't just include medical care and pharmaceutical interventions. It includes behavioral and rehabilitation style interventions, but also recognizes the contribution of social determinants of health. One of the ways we ended up partnering with Pepr was through that recognition of the importance of social determinants of health and marginalized populations and how they are more greatly affected or afflicted, I guess, with chronic pain. It's more difficult to recover if you don't have access to the full range of appropriate care, or you don't have stable housing, or you don't have a reliable, stable food source that covers all the nutrients. You are at significantly greater risk of having chronic pain and failing to recover from it. One of the things to look forward to, I think, first of all, is taking advantage of the knowledge mobilization mandate of the Chronic Pain Network to package information for policymakers and to try to systematically drive it into the appropriate recipients' hands, but also to collaborate with other researchers, social science researchers, to find out, how do we best address these social determinants of health issues and lead through that to improve pain care. So I think that's kind of the future, is these sorts of collaborations.